ladies and 4 gentlemen. Thank you for joining us and welcome to another segment of Nursing Knowledge. I'm your host, Julia Ehrmeyer. Today, as part of our 6-part series, we'll be discussing yet another nursing theorist who goes by the name of Virginia Henderson, or as I like to personalize it, Jenny Henderson. Her theory, we will soon find out, has a lot to do with independence and the independence that nursing can gain for a patient. Born November 30th in 1897 in Kansas City, Missouri, she grew up in a great family, and she was quite educated and received her diploma from the Army School of Nursing in 1921. As far as nursing experience, she worked at the Henry Street Settlement 2 years after her graduation, and if you can remember, the Henry Street Settlement was founded by Lillian Wald. Bonus points. And she received honorary degrees from 13 universities. Ladies and gentlemen, I want you to pay attention to that number, 13 universities. This woman is legit, okay? So great to gain knowledge on her. She is in the ANA Hall of Fame, of course, and she was part of the Sigma Theta Library because it was named after her. On a more depressing note, she died March 1996, and it was quite a loss for the nursing world. And you will see when we have our 2 guests, Claire Williams and Samantha Haley, you will see that what an impact she has had on their lives, and what an impact she can have on your nursing view as well. So hold on tight, because we're going to be delving right into this. Our first guest we have with us is, well, she's from the U.S., but she's working currently in Mongolia to make the best of their healthcare system. Can you hear me now, Samantha? How about now? Okay, thank you so much for joining us today. Please discuss.
Oh, thank you, Julie. So I'm here today just to talk to you about Virginia Henderson's 14 needs plan for how to take care of patients. And I've had a lot of experience here in Mongolia, and I'm taking my time out of my day to talk to you about it today. So just the major components of it, it divides into 4 areas, mostly physiological, sociological, spiritual, moral, and psychological. So in physiological, it's kind of common knowledge that people need to breathe, right? So they have to know that, and they also have to be able to eat and drink adequately. So I make sure that everyone here gets what they need to eat, and that, especially here in Mongolia where it's so hot, that we stay hydrated. We also have to worry about elimination and postures, so we have to make sure that people don't get bed sores, or we have to make sure that people get catheters and things that they need if their medical issue needs that. Regular sleep and suitable clothing as well are very important, because if you don't sleep well, then you wake up on the wrong side of the bed, right? So you also have to watch out for body temperatures, hygiene, and safety. Safety is very, very important, because if your patient gets hurt here, then you also have an extra medical issue that has to be taken care of. As well as communication. Virginia Henderson was really, really big on this. The relationship that you have with your patient is so important to their healing process. Under sociological, which, just for your clarification, is how external factors impact you as a person. So her 2 really big factors here are participating in recreation and normal development and cognitive skills. So you have to make sure that even while they're in the hospital, they're still growing mentally, as well as in their own, as well as in their self. So she really thought that once you have to make sure that they're taken care of in a way that they become independent when they leave the hospital. Because if they don't, then they still need you and they have to come back. So The next part is spiritual and moral. It goes without saying, if you don't grow in your own faith, then you're not growing really in any, as well as you should be. You have to take care of the whole person. This is very holistic. I guess some people are sick here. You also have to worry about the psychological, the sense of accomplishment. So people really, in order to grow independently, they have to feel that they are doing a good job. So you have to give them the benefit of their own growth and their own growing themselves and with other people. So again, the relationships between their nurse and their family, you have to cultivate that with them.
Welcome back to Nursing Knowledge. Today I have my guest here with me, Claire Williams, who has so graciously volunteered her time. She's a mother of 25, yes? And so the fact that she's gotten them all up, they've had their pancakes, they're off to school, is quite a feat.
All right.
And still, she's here today,
Okay.
So thank you.
Yes, I'm going to be discussing Virginia Henderson's major assumptions. So let's begin with that.
All right.
Okay, so major assumptions. Patient self-care and independence are assumed to be desired by the patient. So patients should want to be healthy.
And remember that these assumptions must be in place in order for those 14 components that Samantha Haley talked about with us to be achieved.
Okay, second, nurses have the heart to serve, so they want to serve their patients. They desire for their patients' health.
Great assumption.
Third, nurses should be educated at the university level in the arts and sciences. And actually, I went to Austria, yesterday.
No big deal.
And
I know shit.
and their nursing students in Austria do not require university level training. So I found that quite interesting, quite different from the United States.
Absolutely. Totally.
So
Okay, the description of 4 nursing paradigms. Do
okay,
you mind showing us
I
those?
do not.
Thank you.
Individual, environment, health, and nursing. So for the individual, patients require assistance in order to achieve health and independence. So, yeah. Let's see. Mind and body are inseparable and interrelated.
That's beautiful. That's just a gorgeous way to look at it.
Right. It considers the biological, the psychosocial, the sociological, and the spiritual components of a person, which are all necessary to be treated. I mean, let's be honest, you can't treat just the physical. All right. For the environment, all external conditions and influences affect life and wellness of the person. And the basic nursing care involves providing conditions which the patient can perform in order for the patients to perform the 14 activities as needed. Okay. Health. The definition is based on the individual and his ability to function independently in relation to the 14 components.
Sure.
And good health can be challenged and affected by many things: age, cultural background, intellectual capacities, emotional balance, and the individual's ability to meet the 14 components.
Okay.
Let's see, nursing,
Which is kind of a highlight.
a big thing. It kind of brings them all together. Nurses serve the patient to make the patient complete and whole and independent.
Great.
So,
Good to know.
And then nurses should have a knowledge base. Like, they should be knowledgeable in what they're doing, and they should be able to apply critical thinking skills. So,
Absolutely.
quite necessary.
That is great. I feel like my mind has just exploded with knowledge with Miss Williams being here today. Mrs. Sorry.
Yeah.
Can you imagine? Mrs. Williams being with us here today. So I cannot thank you enough for taking the time out to explain the major assumptions and the descriptions of Henderson's 4 nursing paradigms.
You're very welcome.
Thank you. I will release you back to the children,
Aw.
but you have a wonderful day.
Oh, you too. Thank you.
Components. In summary, okay, what we have here is a nursing theorist, Virginia Henderson, and her theory, the main component to get here is that it dealt with 14 main components, okay, and it was all about achieving independence for the patient, helping that patient achieve those 14 components. Great, knowledgeable woman, and definitely should be considered when applying nursing theory to real life. Again, this is another segment of Nursing Knowledge, and we thank you so, so much for joining us. I'm your host, Julie Angermeyer, and you have a wonderful day.